Welcome to the Menopause and Cancer podcast, where we speak with cancer patients, survivors, and incredible experts in their fields to help us find solutions to our symptoms and ideas to improve our health. I'm your host, Danny Binnington, and I'm so excited you're here because this episode is packed with wisdom, warmth, and practical tools for anyone navigating life during or after cancer. I'm joined by the fabulous Tiffany Troso. She's a brilliant medical oncologist with over 25 years of experience. And today she'll share with us her passion for empowering patients and especially women to take charge of their health and well-being. There are so many stories to unpack here. We talk about managing menopausal symptoms to, in general, the emotional weight of survivorship. We talk about the power of communication so that you get the help and support you need. Dr. Troso is a wealth of knowledge, and her top tip, which, spoiler alert, is also the name of the episode, You Come First, has really, really surprised me, but it's absolutely fabulous. Make sure, on another note, that you tune into my new special bonus episodes on Friday. So watch out for the one coming up this Friday. And I've recorded my first bonus episode last Friday as I take you through the launch and something super, super exciting that is happening. But that's just a little side note. For now, you come first, and please buckle up and let's welcome Dr. Troso onto the show. Dr. Troso, we made it. How are you today?
I'm so well. Thank you so much for having me on your podcast. It's a pleasure to be here.
It's absolutely amazing to sit here with you. Would you introduce yourself to everyone listening?
I would love to. So, hi, everyone. I'm Dr. Tiffany Troso. I'm a medical oncologist. I've been in practice for over 25 years. I specialize in breast and gynecological cancers. I was at Memorial Sloan Kettering for 25 years, including my training all the way through being an attending. And I recently retired in August, and I have a new venture in which I am trying very hard to reach as many cancer patients as possible so that I can help them along their journey. And so I'm sure we'll get into that a little bit more, but my whole status is that I want to help educate and empower women during cancer treatments.
Which is amazing. Is this something that you felt as a medical oncologist working in the traditional sense was missing from practice, or that you felt people needed this more, or why are you so passionate about enabling people to find their agency?
I love how you put that. I am absolutely 100% felt during my time in the clinic, seeing thousands of patients, that it was very difficult for the physicians to meet the patients where they were in the finite amount of time that we had in the clinic between going through psychosocial activities with the patient, their own mindset, and also taking care of their cancer as well medically. And I feel that there's an enormous divide between where physicians are and where patients could be. I really felt that if I had more time, if I had more, supplies or ability to educate patients more, they would have done so much better. Of course, we did the very best that we could, and I was always running late because I was always trying to do more in the room with the patients. But I really feel that there's an enormous potential here to help women with cancer, and even in the survivorship role, the pre-vivor role, and in terms of educating them, empowering them, and helping them feel to be part of their treatment, having confidence and clarity about what's going on. And I think that is so important because it helps alleviate a lot of the stress and the fear of the unknown as well. So we could talk about, I could talk about this all day.
And really, I could talk about this all day because I just spent the most amazing few days with a group of 20 survivors, and we took them onto a well-being retreat, and it was absolutely amazing. And the three biggest topics that came up in the many conversations and workshops we facilitated were fear, as you just said, the fear of the unknown. There were also the who am I, like the who was I before cancer, who am I going to be, and it was confidence. And so we will talk about those because I know I'm sure they're part of your work.
Sure.
talk to me about second opinions first, because I know you're also very passionate about second opinions, and you give second opinions to patients so they can come to you
Sure.
for second opinions. Like, is it good to have second opinions, or do you think people do have a second opinion because they are looking for an answer and they're looking for the answer that they want to hear?
That's a great question and a really interesting perspective. So from a physician's standpoint, when you're younger in your career and maybe feeling a little less confident in your own skills, when patients would go and get a second opinion, oftentimes they would go behind your back and not tell you that they were going to go. And
Yes.
then the other physician would call you and you'd be, happy to help. As I grew and as I developed as a physician and as I matured, I realized that it's not about me. It's about the patient, and that it is always a good idea if you have the time to get a second opinion, because there's always something else to learn. Even if physicians collaborate together, the point of the matter is to always give the best treatment and approach for each patient. And perhaps there's something that I didn't think of, or perhaps there's something that they were able to explain better than I could. And so again, at the end of the day, if you just take it all back down to, I'm here to serve and I'm here to help get this patient to the best possible outcome that I can get them to. And so again, it's getting a second opinion it's not about me. It's about the patient and the patient feeling comfortable and confident in their pathway. And so I am a very big proponent for second opinions. And I think it's very important for physicians in general to be open to collaboration for all the reasons that I just mentioned. One caveat that I do want to mention, because I have seen this, is if you have a cancer, say, for example, you have a breast cancer and it's been decided that you're going to have neoadjuvant treatment, right? Treatment before surgery, and the tumor is still in place, and you want to go see Dr. B, and I'm at hospital A. For Dr. B to see you and give you a true opinion, they need to review your pathology as well. And so that's often the sticking point in second opinions. So if the pathology slides have to go from hospital A to hospital B, then be reviewed, and then you go in to see the second doctor, there could be a time span of weeks to months. And so my caveat is that you have to take each circumstance for what it is. And if time is of the essence, then sometimes a second opinion, waiting for that second opinion might not be the best idea. Because I've seen that before. I've seen terrible when a patient will come to see me and say, I've been waiting to see you for weeks and they haven't started treatment yet. And I had no idea, of course, because they go through the administration. I don't know what's coming in the door next week. So, then you feel terrible that the patient's actually waiting for your opinion when they really should have started treatment a couple of weeks ago. And I have even in some circumstances told the patient, you know what, you're set up over there. I agree with this recommendation. If you'd prefer to be treated by me later on, start your treatment there. Let me get everything lined up over here and we'll transfer you over later. You can still come and see me. I can still help you, but I don't want patients to hold up their treatment if they need to start it. So
we had so many conversations about that this the past few days, and often we need to empower people to seek a second opinion because people feel worried they go behind their doctor's backs. We don't want to be the patient that disagrees with their doctor. We also are maybe worried of getting conflicting advice, and what do we do then? In all of those years, I'm assuming 20 years ago when you were practicing, people didn't talk much about how their cancer treatment impacted their menopausal symptoms, because people didn't talk about the menopause in general, right?
Right.
Now, so many more.
They did. It just, it wasn't
they?
it wasn't, I mean, of course, because, as a breast and gynecological oncologist, more than half of my treatments are putting my patients into menopause in one way or another, either surgically or chemically. And so we were always dealing with the side effects of menopause. But I think that the whole overarching mindset issue and the whole picture of menopause in terms of cardiovascular health, Alzheimer's, dementia, bone health we did address. Vaginal dryness I would address, mood swings I would address, but in general it wasn't quite as comprehensive as it is now because there's just been so much more attention spent on it now.
Yeah. And then often we have patients who have completed their active cancer treatment
Mm-hmm.
and they're really struggling with the menopause and
Yep.
menopausal symptoms, sometimes years after the active cancer treatment.
Mm-hmm.
And they might not be able to access their oncologist anymore or their general practitioner, or they might go and seek a second opinion. And then what do we do if we get conflicting advice?
Mm.
How do we navigate that as a patient?
Yeah.
It's a tricky one. And I sometimes feel like, do we go and seek those second opinions because we didn't like the first answer we were getting? So could we go around to houses and see lots of doctors until we find one who shares our opinion? And then, do you know what I'm
Yeah.
trying to say? Yeah,
100%. I see what you're saying. Sort of shopping for the answer that you want.
kind of.
Yeah, that's tough. That is tough when you get conflicting opinions, and that's probably the other downside of getting a second opinion. You could end up getting, you get four opinions, you could get four different opinions. Actually, I think that part of that is probably, again, based in need to be educated yourself, and so by really understanding why the doctor is making the recommendations that they are. And if you don't understand, to challenge them nicely, of course, but just ask them, like, I don't understand that. This doctor said this, and why don't you agree with it? And again, that shouldn't seem as a challenge to the physician. That should be something that needs to be professionally discussed. And sometimes the two doctors need to get on the phone together and say, this is my thought, and these are my thoughts, and compare them. And sort of come up with a solution that's personalized for that patient. Because I don't think that in the manner of treating menopausal symptoms for breast and gynecological cancers, there's a whole range of different options and different recommendations based on the type of cancer that you had, the time from the cancer, the stage of the cancer. There's so many things to take into consideration that I think is really important that each person discusses it with their physician, and really we lay out a plan that's personalized for the patient, because there is no one right answer here.
Yeah, yeah. So what did you think was missing then in those many years, decades of helping cancer patients and especially women? What do you
Mm-hmm.
think was missing for them? More time with their oncologist, more time with a counselor or a coach? What was it?
I actually think all of the above,
Yeah,
because each one has to provide a different set of advice or information for the patient. I think more time with the physician would be wonderful, because then the physician can really educate the patient. Some patients don't really understand the difference between a PET scan or a CAT scan, why they're getting one and not the other. They don't know what ctDNA is, or why some patients are getting it and they're not. Even some patients don't understand, what HER2 is, for example. And so just by understanding more and educating yourself, you'll have more clarity on the diagnosis, and it's easier to follow along. Patients these days are not the patients that, when I was growing up, right? We don't just sit there and say, yes, doctor. We want to understand. We want to participate in our care. And so I think that's a really important point, that, if physicians had more time to actually spend educating, this is one of the reasons why I created my online course. So I have two courses that I created. One is for patients, and one is actually for caregivers. And it goes through basically all medical oncology, sort of from the moment that the patient knows something's wrong all the way through till survivorship. And, I'm still building it. It's and it's an active project of mine, but I'm trying to help patients with this education, knowing that the physicians don't have the time in the clinic necessarily to fill in all those gaps. And so,
yeah,
a lot of what I do as a second opinion, especially when I'm working with a patient one-on-one, is fill in those gaps. I'm not there to
yeah,
challenge or fight with the other doctor. I'm actually making their life easier, because I am filling in all of the gaps of
yeah.
understanding. And so patients have more clarity and confidence in what they're discussing with their own physician.
Mm.
The other thing that I think is really lacking is there was never enough psychological support for the
Yeah,
patients. And, especially even at a place like Memorial Sloan Kettering, which is well endowed with lots of resources, there was never a social worker or a psychologist that was readily available. I would try to get my patient an appointment with, the psychiatrist, and it would be weeks to months until they could see someone. So oftentimes, as an oncologist, trying to help my patient get through their treatment, I would start the medication. After a certain amount of time, I'd say, okay, look, we'll try low dose of Lexapro, for example. You need a little bit of Xanax to help you fall asleep. I would fill in those gaps. I know not all physicians are comfortable doing that, but I feel like it's part of the holistic package of helping patients. I would also recommend natural products as well, such as like L-theanine, which I find is wonderful for stress and anxiety. But when things got more complicated, if that first beginner dose of Lexapro wasn't sufficient, hopefully by that time I've already gotten them in to see a psychiatrist or the psychologist for more talk therapy. But we spend a lot of time on mindset in my clinic. My nurse and my nurse practitioner were wonderful, and they would always help with that. Now I take it all on myself. So I spend a lot of time with patients, try to reorient them to where they are in their journey, what their aspirations are, what their expectations are. Because sometimes if those two things don't match, aspirations and expectations, there's a mismatch, causes dramatic anxiety and mistrust, actually.
Can you elaborate a little bit more? Because I hear it all the time in conversations. We are so mismatched for so many years afterwards. There is this burden we experience, but we also don't want to burden others. So we can't let go of our burden because we don't want to burden others. So again, that is mismatched.
Of course.
It's right? So it's the expectation on the healthcare team. And often we feel that isn't met. Like you explained so beautifully, it's just not enough. And you want a little bit more hand-holding. You just maybe need someone to explain to you again or ask again.
Exactly.
This person I spoke to today, she said, I'm having my follow-up with my surgeon in a few weeks' time, and I've got such a long list of questions. And I should have asked them all before the surgery, but now I still have those questions because they weren't answered then. So what's the mismatch you find a lot, especially when we talk about women? We carry so much around with us, don't we?
There's so much to unpack there. One thing I want to just quick advice want to give is that if any patient has like lists of questions that they need answered because it still is not clear to them, I always recommend that you, if you can, send the questions ahead of time through your portal to your nurse and say, I'm coming in on Thursday. I would like to address these questions. Because sometimes in a very busy clinic situation, if you're not aware that the patient has 12 questions that they want to answer and you're running in just to give, a quick checkup and say, okay, everything looks good, I'll see you in 6 months. That way the doctor can plan properly and, have the expectation that, okay, I have to make sure that I have an extra 15 minutes to sit here with the patient to review all these questions and answers. So, that again, that's part of advocating for yourself by, sort of putting it out there right away, preparing the doctor to know that I've got questions for you. This isn't just going to be a pat on the back and go home. And so I think that'll be very helpful. And I think your patients might, benefit from that kind of advice. So going back to what you were saying before, I have found over the years that women being the caregivers, they're the rock, the glue to holding their community, their family, their household, even sometimes their workplace, right? We carry so much of that in being the caregiver to everyone else. And so once you have cancer, that whole thing changes. Everything changes. Cancer knocks at your door and we have to rewrite the script. And essentially, I've actually in practice taken my prescription pad and written on it for a patient, you come first now. And I hand it to them and I put this on your refrigerator, put it in your car.
Wow.
I want you to look at this because right now, if you don't take care of you and all that involves, cancer is a real thing. This isn't for play. This is for life, right? And so if you don't come first, you can't be the caregiver to everybody else. Everyone else benefits if you take care of yourself first, and then you'll get back to your responsibilities and your duties. But, it's very important for women to realize that this is not just something they're doing on the side. This is it. When you're getting treated for cancer, your full focus, attention should be on that. And that's not easy. Of course, women have all kinds of crazy responsibilities. We could both talk about that for a million years. But part of developing your own community which is, again, part of empowering yourself. You develop your community. You communicate with your family, with your spouse, with your children, with your friends. This is what would help me and how you can help me. And women don't like to do that because we don't like to ask for help. We like to do everything ourselves. But that's important because people want to help you. Everybody wants to help you. Everybody wants you to get better, but often are afraid to say anything because they don't want to insult you or step on your toes or something. So part of advocating for yourself is actually communicating with your community. And the same thing goes for your healthcare team. You need to be able to work with them and have them understand how you want to receive information. Some patients don't want a lot of information. Most do. Yeah. Most would like it. Doctor, could you write it down for me? Would you mind just taking notes on what you said? Or do you mind if I tape this? Where I was at Sloan, we weren't allowed to have patients tape us, but I would often bring patients, family members in on FaceTime, put up their little phone on my desk so that they could see me talking to their mother or what have you. And I would always take notes and make drawings, photocopy them. So I had something for the chart for me as well, and hand them to the patient. And I would always recommend that the patients keep a binder, like a real 3-ring binder. And I have a whole program that shows you how to set up that binder. Wow. Can I tell you a little story? I had a patient. I'd love to, yeah. Oh my God. The loveliest, loveliest family. I think they were originally Pakistani in origin. And the wife she actually had endometrial cancer. And she would come with her husband and her daughter. And the patient was very, very scared, didn't say much at all. The husband and the daughter would do most of the talking for her. And the first couple of times I met them, the doctor, you never have all the records you need. So I'd say, do you have the CAT scan from April? And he would have this shopping bag and he'd start flipping through papers and running through all, there's papers flying everywhere and he can't find it. And he's getting all agitated and anxious. And the daughter's trying to calm him down and then she's trying to look through the bag. I put the patient, she was starting her chemotherapy. I put the patient back into the treatment room. She started her chemo. I pulled the daughter and the husband aside. I said, do me a favor. While she's getting her hydration before she starts her chemo, go to Staples, which is, like an office supply store. I need you to get me a 2-inch 3-ring binder, some clear plastic dividers, some, the paper sheets and then dividers, and let me know when you come back. So my nurse and I, for our lunch period, right, while we're eating our turkey sandwich in the back room, took all of these records and put them all out on my desk and just sorted through them, filed them, hole punched them, stuck them in the binder. And I made him this beautiful binder. And I presented it to him back in the chemotherapy room with his wife. I could cry. He actually started to cry. He was so touched that somebody took care of him and somebody took the time to help him. And it was such a little thing for my nurse and I to do. It took us 10 minutes because I know how to sort it. I know what the papers are, right? And I realized that something so small like that, a gesture like that, makes all the difference to a patient. Because not only did they feel that we cared and that we were trying to help them and meet them where they are, but also now he had this binder that empowered him because now he knew where all the records are. Now he could flip through them and he could talk through them, what have you. He brought this binder every single day, every time he came to the treatment. So they were lovely. But it's just one of those moments in 25 years of practice that just stuck with me. That these are the little things that you wouldn't expect a doctor to do, but that is so meaningful for a patient, so helpful, right?
But you also probably gave back a bit of control in a time where everything was out of control and chaotic, right?
Absolutely.
And when it's all overwhelming. And I was one of those patients. I was a mum to 3 daughters already. So I was a grown-up woman when I was diagnosed with breast cancer. But one of my very first appointments with my surgeon, who then treated me, was with my dad and my husband. And I sat on the side to my oncologist. So my dad and my husband sat opposite the oncologist's wooden desk, and I sat on the side on a sofa. And I also couldn't ask many questions. I was too scared what the answers might be, and I let them do the talking. And now thinking back, I think that's crazy. But I just didn't have it in me to ask more. And it was my only way through I just almost had to shut down a little bit. And it's amazing what doctors can do for you when you least expect it. It's amazing the impact and every word can have, because I still remember words, and it's usually not the good ones that we remember,
Yeah.
but I still remember words that were said from all those years back, because the mind has a ways. And it's, I think words are so powerful and actions are so amazing.
Yeah.
One thing you said earlier about you come first, that really touched me as well, because that's a hard thing to do. You come first, a hard thing to realize, when actually it is also very scary to think we're going to put our whole family and our environment and our parents maybe and our siblings or children and friends through a really difficult experience too. But one thing that did come out of many conversations I've recently had was people saying, I finally had the courage to say to my family what I enjoy.
There
And
you
for
go.
years, they would pretend maybe to enjoy snowboarding, or they would pretend to enjoy certain activities.
Yeah.
And suddenly they said, I love you all very much, but actually, I don't really enjoy going snowboarding. I'm going to go and do snow walking. And it's having
I'm
that
going to the
courage
spa.
as well. That's it. Instead of always bending over backwards to keep everyone happy. And I think a lot of courage has to be brought to the table to finally say that, because we keep thinking we're selfish, don't we? If we don't do everything for everyone else.
It's not selfish. It's survival, and it's thriving. I know that's kind of a catch-all word, but in order to, as I was mentioning before, it's part of empowering yourself, helping your friends and family help you and work with you and meet you where you are. And so, patients have to learn to speak up, exactly like you're saying. And, that's not always possible. Every dynamic and family situation is different. And some patients might not feel comfortable telling their husband that, I really need you to get takeout tonight for dinner. But, I'm just, there's so many ways to look at it. I mean, I've seen so much in the clinic. If something doesn't feel right, you need to speak up. You really do. And, and it's hard. Like I said, I've seen patients come in with family members or even spouses that I could almost tell by the first or second meeting whether or not the couple was going to stay together, just by how the husband was reacting or acting towards her. And
wow,
it's not uncommon. It's not common, but it's not never that patients, they break up while the patient's under chemotherapy. I've seen it because it's, an enormous stress. And if the relationship wasn't solid to begin with, sometimes the riff is not fixable. And you can see that sometimes. I mean, I'd never say anything to a patient. That's not my place, but it's hard. You can definitely see that.
Wow, the extra burden, isn't it? But also, sometimes we do wake up. It is a bit like we are now waking up to, who am I and where do I want to be in the future and who do I want to live with? And is my partner the partner I really need to support me through? Or am I doing all of the hard work and have done for the last few decades and I'm done with it? Maybe I'm done with the relationship.
Right.
And you have to be so brave to move through that and identify that for yourself. And I think our partners, they mean very well, don't they, partners?
Of course.
But because of the lack of communication that you had mentioned earlier, they also get it really wrong. Like I know of people whose partners booked them, I don't know, an amazing holiday that they never really wanted to go on, or go up in a hot air balloon, someone said to me recently, 2 days after chemotherapy. You're like, why would I want to do that?
Yeah. Unfortunately, stressful situations will bring all of those things, all of those qualities and the relationship situations really to the head. And so it's tough, because stressful situations are when things really come out sometimes. And I mean, the thought of, I've seen it, the pain of a woman, making different choices and deciding perhaps that this isn't the relationship or the situation that I want to be in, but are also dealing with the stress of battling cancer. It's enormous. That's enormous. And that's absolutely a situation where I would refer a patient for, real psychological counseling, because as much as I want to help, that's the next level. And that needs some real attention. And so that's an important time to refer a patient to see a counselor, a social worker, or a psychologist.
Yeah. So as an oncology doctor, Trosa, who makes binders for their patients, who tells their patients, you come first.
Mhm.
What else is in your little box of amazing? I know you've put it into a course, but what is in your sort of wealth of knowledge that you want survivors to know that can help them move forward?
Survivors or treatment patients? Because those are a little different.
I think for us, it's more survivors
More
at the
survivors.
moment
Okay.
because, yeah, we're most of people listening to our show, they've been put into the menopause after their active cancer treatment. They're waking up to many symptoms and they're trying to find solutions and they haven't got the answers currently. So I
Sure.
think we're more the survivorship space.
So I would say that the first thing I would do, and this is, I'm taking it from my treatment patient paradigm to the survivorship paradigm. I always recommend that patients get a weekly and monthly planner. And I'll tell you why. A monthly planner, you physically put in all the important days of your month. People do it on the phone now. I'm old school. I like it on paper. I think it's easier to see it all in one place. On the weeklies, when you open up the binder or the planner, each day of the week has a nice big box. And I instruct my patients to write down all of their symptoms, side effects, thoughts, whatever's going on, I want to know about it. And by having it in the planner, you have a date and you can relate it to other things. So it's much easier to track different symptoms and side effects, for example, if you have them chronologically in order and described. So if you found that you're having a lot more anxiety and you were having difficulty sleeping and you were taking your aromatase inhibitor, for example, at nighttime, sometimes we would just try switching it to taking it in the morning and see if that helps track the symptoms. Sometimes we would need to change the medication. Do that, track the symptoms. It just makes it a better communication tool between you and your physician or your caretaker, because it's not just like, oh, my back always hurts. You can say, look, my back hurts 5 out of 7 days a week. I'm doing this exercise. I'm taking this medicine. I'm taking, glucosamine and chondroitin and my omega-3 fatty acids. And when I stop them, my arm hurt. That way the doctor can actually see the pattern of symptoms, what you've tried, what doesn't work, what has worked. And I just think it's a really good communication tool, regardless of where you are on your treatment journey.
Yeah. I found it always really hard when I went to my doctors to explain my symptoms.
Mm-hmm.
And I was worried to explain my symptoms because I always was so worried they might lead to a secondary cancer diagnosis or to
You
more
didn't
bad
want
news.
you didn't want to admit it almost, right?
No, and so I was sitting on those symptoms for so long. Am I making it up? Am I feeling this lump? Is it a lump? Is it a little lymph node, or is it something? And I was sitting on those things, and it was really difficult to communicate. And actually, by having almost like a job to do, write it down, note it down, it would have been very good to track, actually.
I think that I have two things to say about that. One is that by writing it down, it sort of releases the energy or the need to keep remembering it in your brain. Because now you've kind of released it onto a piece of paper and it's still documented, but you don't have to keep thinking about it quite as much. That's one. Two is that just fell out of my mind.
Yes, but I know what you mean. But also, it's also the time. I often went back to my oncologist and then said, I've been having this lump for like weeks. And my oncologist tried to figure out how long. And I couldn't remember. Has it been that? Because I was sitting with the not knowing what to do about it for so long. And so actually having these actionable plans are really helpful.
The other thing, sorry.
Yeah.
I just wanted to, I thought of my other thing that I wanted to say regarding the sitting on the symptoms and not wanting to express them. I've said to my patients for years and years, it's not your job to decide what's important and what's not. That's my job. Oh. It's not your job. You have to just tell me, and I have to sort through what I think is significant and what I don't, and what I think needs to have further workup and what could just be reassured. And, because of, especially if you're seeing a physician that has years and years of experience, you should never be afraid to tell them their symptoms. And like I said, don't worry about burdening them. That's my job. That's my job to help either figure out if there's really a problem or not.
Yeah. And then I want to flip that on the head though, because when we're really just talking about, for example, the late effects of menopause for cancer survivors, I would like to speak for our community, but many feel no one cares anymore. Many people say to me, now I'm telling my doctor I've got all of these symptoms and no one is listening. Many people say I've been trying to beg and beg and beg for help, and actually the help isn't there and no one is really acknowledging my symptoms. It's because the cancer treatment was the primary focus, but so many are struggling with the effects of it for such a long time. And then it's really hard to know who will listen and who can help.
Sure.
Because it's not really your primary job either as an oncologist, is it?
Well, it is and it's not. I look at it this way. If I've done something medically to or for a patient, I've put you in menopause, I'm having you take an aromatase inhibitor to treat your breast cancer, I felt my responsibility was to deal with the consequences of what I have given the patient, right? So, for example, a lot of oncologists wouldn't be bothered with this, but I felt if I'm giving you something that puts you in menopause, that's detracting from your bones, it was my job to order a bone density. And so I did. I would get a bone density every 2 years, which is what we're allowed to do. And I would, advocate for calcium, weight-bearing exercise, make sure your vitamin D level's right, all those good things. The wide gamut of problems that come with menopause, I think, especially when it comes after, 5 years or so, you might not even be seeing your medical oncologist anymore. What I think is really important, and there's a growing educational process going on here for survivorship. There should be true survivorship programs. There are millions of patients that are in survivorhood now, and they need their conditions addressed. We're doing so well curing patients of cancer, and then what do they do? And, there are a lot of doctors I know that are focusing on menopause themselves. I think there's still a lot of controversy. It's a hot button topic, but who can get hormone replacement therapy and who can't? I don't even know that I want to touch that here today, but just the general, care of a woman following treatment and in menopause it should be its own specialty at this point. It really should be.
Yeah.
And, I think I was commenting on this in a Facebook group, I think yesterday, that, I'm not quite as familiar what's goes on in England, but I know in the United States, especially at large medical centers, they often will have survivorship programs that, you can Google. Even if you go to cancer.org and you look up survivorship, they can help you find a program near you. And I just think that that's something that we should be looking at, hooking our patients up with. If our offices or facility don't offer it, we should help them find somebody who does. And until we do that, it's our responsibility. That's how I feel.
I feel that is so refreshing, Dr. Troso. It's like so refreshing, and a reason why I was so excited to speak to you, because you've got so much work and all these decades of experience, but you're so fresh with your approach and so passionate, and there is no dulling down, and it's absolutely just wonderful. What do you wish? So, what you're trying to teach people, like this, you come first.
Mm-hmm.
How can we teach these people before they have to get cancer? How do I, as a mum to 3, right? That's the real question. Like, I am a mum to 3 gorgeous teenage girls. Am I conditioning them alongside the rest of the world to put everyone else first and their jobs and their careers and everything? And at one point they would be burnt out, and an amazing doctor might have to teach them, you come first? Or what are we getting wrong?
We're talking about major societal shifts here. I agree with you. I think that, women need to learn how to empower themselves and realize that, like I mentioned before, that if the caregiver is not getting what they need, they can't do the best for everybody else. And so by nourishing and supporting the primary caregiver for love, support, toilet paper, food on the table, right? I mean, women in general have taken on all of the roles. What was that? I don't know if you know that, you're probably too young, but there was a commercial when I was a kid that she had like a frying pan. She go, I can spin up the bacon, fried up in a pan, and never let you forget you're a man. And I mean, that was like so like feminist, like it was ridiculous. But if you think about it, like that's like the role that we're asked. Like, I can bring home the bacon, I can cook it, fry it up in a pan, and I can keep you feeling like you're a man. I mean, think about that. That was like the 70s and 80s. I mean, it's been ingrained in us for decades.
Yeah. I think what's so refreshing, if I spoke to Dr. Troso and you come with your experience, if I ask Tiffany,
Yeah.
do you put yourself first? Have you learned through your patients? Have you learned? For anyone listening to this audio and not watching it, Dr. Troso just had her head in her hands.
I'm working on it. And I can actually tell you that since I've left full-time clinical medicine and I'm doing more concierge work and I'm doing more education, I'm learning how to find the time and to support myself. You know, it's hard. We all get wrapped up in our business and, you know, you're working and working and working, or you're running your household and it's so busy, busy, busy. If you fall back on old habits, which are to just, you know, push yourself aside. I mean, just the other day, my husband said, "Did you get your mammogram this year?" I'm like, "I'm making the appointment today." And I mean, think about it. It's like the shoemaker who doesn't have any shoes, right? What do you mean you didn't get your mammogram, Tiffany? So we all fall victim to this. And, you know, I think it's a matter of just readdressing it and reconditioning ourselves to remember that we have to come first. Otherwise, everything else goes to waste.
Thank you so much, because I think it's so much easier said than done, and knowing that it's a learning for you and you're in the process yourself.
Yeah, of course.
It's just so refreshing, because we're all on this journey trying to figure out how to manage our guilt, our emotions, but also I feel like often we wake up and we really understand we deserve to speak our truth, or it's bubbling. There's something bubbling for many survivors.
Yeah.
Something is bubbling, and we want something different after survivorship, and we maybe want to give back, or we want to change career, or we want to be more truthful, or we want to just embrace life in a different way.
Yeah.
And that you come first is so relevant for all of those sort of shifts that are happening. You're an absolute joy to talk to.
This was so
wonderful. love having this
you.
conversation. It's taken us a long time to finally do this.
Well, hopefully
it's really
it won't
wonderful.
be too long until we get to do it again. I'll have to have you on my podcast.
Absolutely. I'd love to. And thank you for your time. You're a delight to talk to. Thank you. What a joy it is to be joined by such incredible people on our The Menopause and Cancer podcast. When I first set out to bring you the experts with this knowledge, I never in a million years would have dreamt that these experts would be so amazing, like Dr. Troso, and come with so much decades of experience. I think in this conversation, there were so many golden nuggets and so many great stories of wisdom to unpack. And I hope it's helped you think, what could I talk to my doctor about? What could I ask about? How could I further my desire to live better, to maybe have fewer menopausal symptoms? What could I do? What conversation could I have? I hope you enjoyed this conversation. And again, it's a Wednesday today. If you're listening to this, make sure to tune into this Friday's next bonus episode. It will be our second bonus episode. If you have not listened to the first one, and do go back, I've recorded the first one last Friday. I'm launching and announcing something super exciting. And these bonus episodes give you a little bit of a behind the scenes insight into something I have been working on and really hoping to achieve very soon, but I've been working on it for years. So tune in to the Friday bonus episodes as well. And with that, I love you and leave you, wishing you a really, really good day.